we were just talking in the break a little bit about hormone replacement therapy. And for many women, especially as they enter, the perimenopause and the menopause stage, that's something that certainly has been discussed with doctors and can be very beneficial to a lot of women.
Absolutely, it can be beneficial, and the evidence would say shortest dose for shortest duration to help in that transition phase, whether it's hot flashes or irritability or insomnia. I'm a big proponent of bioidentical hormone replacement. I think a lot of the studies that have shown side effects and big problems with hormone replacement is based on these synthetic versions of these hormones that are not consistent with the chemical nature of hormones in the female body. So I think that's number one, but there's lots of people, not lots, but there's several people who do bioidentical hormone replacement and prescribe BHRT. I spend a lot more time getting those women off of the high doses that they're on, and I think I want women to realize that there's a therapeutic window and it's pretty narrow. So you don't necessarily want to be too low, especially if you're having symptoms, but you definitely don't want to be too high either.
And why is that?
Sometimes it's the same symptoms, but also a potentially increased risk of cancer because you've got too much hormone. And I think what happens is most providers who are prescribing them, are prescribing them for symptoms and not doing anything else. We're not doing nutrition, we're not talking about stress management, we're not talking about sleep, we're not talking about other, nutrients. We're just relying on the hormones to do all the work, and that's that's not going to happen a lot of times. And so they come back, symptoms are the same, let's push the dose. Symptoms are the same, let's push the dose. Meanwhile, their symptoms are actually getting worse, and we're measuring blood. Blood has a great way of storing this hormone, so it doesn't typically show up high. You wind up doing saliva levels of these hormones, and sometimes it's through the roof.
And then that can be dangerous.
And it's dangerous, and it's tied into their symptoms. And so when I start them, we start them very, very low and we monitor them. But most of the women I work with, we're actually working on getting them off of the toxic levels they're on.
Wow.
And monitoring that. And so, we got to realize there's, too much of a good thing is not a good thing. And this particularly goes, very, very importantly with hormones.
Well, it's a good thing for women to be aware of, because I think that not necessarily doctors taking a cavalier approach, but it seems to be more widespread perhaps than it was just a couple of years ago.
Right, and I think it's it's a byproduct of that sort of narrow focused one, let's just do one thing instead of looking at the whole and working on the other aspects, because nutrition and lifestyle has a huge benefit to hormone balance. It may not do all the work, and this is where hormone replacement therapy can come in, but it's got to be just a piece of the pie.
Not the whole thing.
Right.
All right.